Welcome to Module 5, Worker Health, Safety and Welfare Module. The objectives are to understand the requirements of worker health, safety and welfare, the issues related to worker health, safety and welfare, and the various good agricultural practices that help minimize these issues. As we continue to learn about good agricultural practices this week, we will address the role of farm workers in food safety and show how worker health can have a direct effect on the loss of production and earnings of the farm. Considering that farming involves many tasks, workers are exposed to many types of hazards, making them a potential food safety risk as well. In this unit, we will identify the issues related to worker health, safety, and welfare, as well as the various corrective practices that help to minimize these issues. There are several types of hazards that affect those who work and live on the farm. Injury and illness are a large cost to the health and well-being of farmers and workers. Therefore, reasonable care of their health and safety need to be considered. Accidents are preventable, and as a first step, it is important for workers to be aware of hazards. Most common hazards occur during operations and can be mechanical, chemical, biological, electrical, solar radiations, noise, stress, fatigue, and welfare. Workers can carry, introduce, and spread contamination to fresh produce while they are working on the farm. Human pathogens can be spread through many routes. However, the fecal-oral route is most common. This can happen if a worker does not wash their hands after using the toilet and then handles produce, contaminating it with fecal material. Pathogens can also spread through saliva and mucus and contact with other contaminated surfaces such as clothing, footwear, tools, and equipment. Workers must wash their hands at times where hands may have become contaminated. Worker training should include how to wash hands, and workers should be given opportunities to practice this skill during the training. Workers must know what to do if they are ill or injure themselves while working. This reduces the risks of human pathogens, blood, and other bodily fluids contaminating fresh produce, fields, and packing houses. Remember, workers and the training they receive are very important since workers play a key role in food safety on the farm. When managing risk hazards to workers' health, safety, and welfare, several questions can be asked to ensure that all steps for reducing the risks are taken. First, to identify the hazard, you may ask, what can happen to workers' health, safety, and welfare if something goes wrong? To assess the risk, you may ask, what is the likelihood and consequence of the hazard occurring? In controlling the hazard, one may ask, what gaps are required to prevent or minimize the risk of injury or illness? For monitoring and reviewing the hazards, you may ask, are the gaps working and have there been any changes that introduce new hazards? We will now take a deeper look into the ways good agricultural practices can lessen hazards to workers' health, safety, and welfare. Firstly, when dealing with chemicals on the farm, it should be handled only by trained workers with appropriate knowledge of their use. Workers handling chemicals must have suitable protective clothing and equipment. Chemicals should be stored according to the instructions found on the label and should only be accessible to authorized persons. Safety and emergency instructions should be prominently displayed, with first aid kits readily available in case of contamination. Although we encourage recycling on the farm, the reuse of empty chemical containers is unsafe and prohibited. It is important to have suitable working conditions on the farm. This can be achieved by indicating hazardous areas with warning signs like danger for immediate precautions to be taken by workers. Guarding dangerous electrical installations or power plants, as well as maintaining farm vehicles, tools, and equipment on a timely basis can ensure good working conditions. Also, providing workers with a safety operation manual on handling practices can reduce risks. Farmers and workers should be trained on personal hygiene practices while working on the farm. Written instructions can be distributed and displayed at prominent locations. Routine medical checkups are advised, especially for those handling chemicals. Toilets, hand and body washing facilities must be readily available and maintained in a hygienic condition. In addition, there should be proper disposal of sewage to minimize risks of contamination. To ensure the welfare of all workers, everyone must be treated fairly and equally in all respects. They should not be exploited due to gender, age, or other reasons. The Bahamas, through the Ministry of Labor, has set out the minimum working conditions, working hours, age, and wages that farm employers must comply to. Food safety practices are learned, so training is key to successful implementation. Safety training of workers should be conducted when working on site for ease of adapting and understanding why the practices are required. Workers should be trained in their areas of responsibilities primarily, as well as in another area in the event of an absent worker. An annual review of training needs should be conducted to ensure that risks are reduced over time. As the Bahamas diversifies its agriculture sector towards agritourism, visitors and food safety concerns should be addressed. Visitors to the farm must be made aware of food safety policies set by the farm, and visitors must have access to toilet and hand washing facilities. Policies can be reviewed with visitors through the use of posters, handouts, short policy summaries, or verbally when they enter the farm. Supporting effective food safety training engages everyone on the farm in the food safety program. With a food safety program successfully implemented, the workers' health, safety, and welfare will be secured. Thank you, and we look forward to your participation in the concluding unit on produce quality management.